Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Kassim Mustafa and this is Your Health is Your Wealth. What comes in your mind when you hear about infertility? Someone is married but he doesn't rear children. Today, we will be diving into this serious topic that is affecting so very many families out there. I'm joining Dr. Zahra Omar, a fertility expert based here in Nairobi at Victoria Fertility Centre. What are the causes of infertility? How is it diagnosed? What are the possible solutions for infertility? Daktari, assalamu alaikum wa rahmatullahi wa barakatuh and welcome.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Daktari, you define for us what infertility means.
For you to be diagnosed with infertility, you have to be a couple that lives together. If you are under 35 years, we say you have lived together for more than 1 year. That is the cutoff point. And you have been trying, having regular sexual intercourse, minimum we say 3 to 4 times a week, and you've been targeting your ovulations. Because we know couples who live in different areas, so you have to have at least tried, you have to have a knowledge of your menstrual cycle and you're targeting your ovulation, and also you're not using any contraception for 1 year. And if you're above you're above 35, we return it to 6 months. If you've lived together for 6 months, you've been trying every month to get pregnant but it's not happening, karibuni.
Mtu ameolewa for so very long time, 1 year. 1 year is a very long period of time. They are married. They are not getting a child maybe. What are most possible causes of this infertility?
Usually what we do here, we try to take both the female and the male. So sometimes the female has issues with the period, meaning maybe they have fibroids, they have endometriosis, they have polycystic. All these are diagnoses that are given by their doctor. Okay, and sometimes they are blocked tubes, which means the sperm cannot travel all the way to get the egg and fertilize. And for the male, we know these days we have a lot of male infertility. We have problems with erection, problems with the sperm count, maybe the sperm motility doesn't move very well. So it's always good, once you have noticed that there's a problem, to always seek your doctor's advice and try to see what can be helped. As we are aging, we know the fertility right now is less than what our parents and grandparents had. And we have things that have contributed to that, like change in our walking habits, change in exercise. These days, everyone is either driving, taking a boda. We are not very active as we used to be. Also, the type of food that we consume these days has a lot of fat, a lot of salt. It's a very unhealthy diet. And we have these substances that most people in our community do use, like miraa, mogoka, using alcohol, using cigarettes, which are not allowed, but still we find a lot of our people in the community using these things, and they negatively affect your fertility.
Okay, maybe talk about some of the things that someone can do apart from exercise and other activities. We have some of the drugs that someone can use maybe to boost his fertility rate, or vitamins that he or she can use to boost his fertility rate. So what are some of the vitamins or foods that someone can use to boost his fertility?
So first you'll need to come to the clinic. We check your hormones as both male and female. We also have to do a sperm analysis. Then when we know what is down, what is up, what is the issue, where the imbalance is when we can recommend. Every patient is different. So there isn't a drug that is for everyone, though generally in the pharmacies you will find a lot of medication that helps in conceiving, but maybe you are using something that is not meant for you. It's always good to have your results, and based on that is when we tell you maybe you need to use coenzyme Q10, you need to use inositol for people of polycystic, and how long you need to use it and what the dosage is. So it's really important to ask the appropriate questions in terms of what the problem is and what the medication to that problem will be.
Okay. Now you've received a patient who have come here to seek medical attention from you. What is the procedure? What do you do first, and how does it go up to realizing or diagnosing this person with maybe infertility?
Okay. So usually we have patients that can come to us, and sometimes we have patients that are in another town or even in another country. So we would advise you to do the baseline. That's meaning you do a blood test to check your hormone levels, both the male and female. Also, we check for any infectious disease. If you tell us you have hypertension, diabetes and everything, we will require that to be at the best level, that you have treated yourself, you are under medication and everything else is going fine. Then we also need a sperm analysis. A sperm analysis in which you have abstained for minimum of 2 days. That one gives us a good result, and we know the true picture of how it's going. And if it's someone who is here, we also add an ultrasound. This is a transvaginal ultrasound because it tells us many things about your reproductive organs. So in your ovaries, we look at your antral follicle count. That means in the ovary, there are those small follicles. So the younger you are, the more follicles you have. If you are above 40, we will require you to do it here so that we can count how many follicles are left. And also we check your uterus. Does it have anything like structures, polyps or fibroids? And then we advise now, according to the results we have, what we are going to do forward.
Okay, now there is this thing we call ART. To what extent is ART applied?
Okay, so artificial reproductive technology is a technology that has been around since 1978. That was when the first child, she was called Luisa, was born. We used to say it was test tube baby, but in reality they are not made in test tubes. So what happens is, once we have your results, now we can tell you. Now, assuming the lady has blocked tubes, there's no way the sperm can go and pass through the tubes. So we have to bypass these tubes and make sure this fertilization takes place in a lab, in a special ART lab. Fine? So first, we are dealing with the menstrual cycle of the woman. That means the patient will come to us on either day 2 or 3 of the period. We have done the scan, as we said. We see that they have follicles, and now we want to make sure that the follicles are big and we can fertilize them. Fine? So I'm going to talk about IVF first, and then IUI is the lesser ART procedure. So in vitro fertilization means you will do the fertilization outside of the body of the human. Fine? And this is allowed in Islam, because Islam says that if you are having reproductive problems and infertility, you have to seek medical attention, because we do like to reproduce. And if it is medically acknowledged, then there is no problem with it. So IVF means we give you some injections. We make sure that, let me use this, we make sure that your ovaries here are producing enough eggs. Fine. So these ovaries here are being stimulated. We say ovarian stimulation. So these eggs, because every month we have one. So when we are doing IVF, we are spending a lot of money. We want to make sure we harvest a lot of eggs. So we make sure we are giving you injections every day. And we are looking at how you are responding to the injections by doing a transvaginal ultrasound. And then according to your cycle, there's a day when you will be ovulating. So IVF means we are going to give you injections to make sure that your ovaries are stimulated. We know every month you produce 1 egg, which is going to get pregnant. But because you are paying a lot of money for IVF, we want you to have many eggs that we can harvest. So we give you on your stomach some injections every day, and we look at the response from the transvaginal scan. And according to your cycle, we know after like 2 weeks you will be ovulating, and we are doing the scan. Once the follicles are around 18 to 20 millimeter, we are now planning for our egg harvest. So what happens is you go to the theater, we are using a simple suction machine with the scan to retrieve our eggs. So the egg retrieval is done, and then in a special lab which we have behind this wall is where now we take your husband's sperm and fertilize the eggs. And once the embryo is formed, it's kept in an incubator. And once everything is seen ready, there's a doctor called an embryologist. He's the one who will tell us if the embryo is in which state, which grade is the embryo. Then we plan on another cycle. These days we don't do fresh transfers, we do frozen, because it has shown to be giving us very good results. So we plan on another cycle. Your embryos will be here in the freezer. We prepare you. We prepare this uterus to be receptive to the embryo. So you come when your other period now comes, is when we insert a small catheter like this one. We insert it here, and we insert your embryo back to you. So there are things that are considered, and whether you get pregnant or not, that depends on Allah.
Now talk about, you were to talk about ART.
Yes.
So talking about ART, for how long have you guys been doing this, and what is the number of people that you receive, maybe in a day, in a week, based on the experience?
Okay, for me personally, I've been doing this for like 5 years now. And ART is not only IVF. We have the insemination part, which is called intrauterine insemination. And maybe we say cycles per month. Cycles per month here in Nairobi, we do mostly like 20. We are not that busy, so we do like 20 cycles in a month. And then with IUI, they are done every day, because patients prefer first to start, depending on their results, to start with a lesser, something that is cheaper first, and then later when they have not succeeded, they can go to IVF. So intrauterine insemination is cheaper than IVF, but it depends on your results and what the doctor will tell you, whether you can start with that or not.
How have you experienced? Maybe have you guys received any positive feedback from the people out there that for 5 years, for 10 years I was married, but I did not manage to get a child, but when I visited you guys, I got a child? How have been the experience?
So we have, alhamdulillah, good results, because IVF is not 100%. That is what we tell the patient from the beginning, to understand that this is just something that will help you up to a certain level. It is up to God whether you get pregnant or not. So the success rates here have been good. We have a few patients that have come back with positive pregnancy tests, and some that have delivered. And some even, it depends. When you seek attention of a doctor and they tell you do this, sometimes even without undergoing any procedure, they tend to get pregnant only using medication. So it usually depends on your factors. What brought you to the center? What was the issue? Was it solved? Maybe some had big fibroids. Once they were removed, they got pregnant. So you don't have to undergo all these procedures, but it's good to seek advice from a fertility specialist.
Now, you as fertility specialist, I know you encounter a number of challenges day in, day out. What are these challenges that you face?
So for us being a super specialist clinic, that's why I said from the beginning, you try to explain. Yes, the patient comes to us with a certain problem. Sometimes it's even unexplained infertility. We've not found anything wrong with them, but they haven't been able to get pregnant. So there is something called unexplained infertility. So we usually tell you from the beginning, this is not 100%. It's a procedure that is done to increase your chance of conceiving. So there's a part of conceiving, and then there's a part of you keeping the pregnancy to term, because there are many women who also have recurrent miscarriages. So we try to consider all these factors. Are you having an immunological disease that is making you miscarry? Is there an issue with your cervix that you need a suture to hold your baby? So we do try to factor in what the issues are first. And then once we have done everything we can, we tell you. So if the results come back negative, we are here with our psychologist and we explain to you. Obviously, it's not a very good feeling at that moment, because these people had all their hopes. So sometimes with ART, as we said, with IVF, we get more embryos. Let's say this person came, we got maybe 8 embryos for them. Yes, we have implanted maybe 2. So there are other 6. So we have a chance with every cycle to implant for you. So whatever thing that was done in the first cycle, we try to adjust. And these days we have something called pre-implantation genetic testing. If you're above 35 and the husband maybe is above 40, we know there's usually a problem of having genetic diseased babies, like maybe Down syndrome, or if there's a history in your family that you've had the miscarriages, or there are sick babies in the family. So we try to do this PGTA, and it's a biopsy of your embryo which we have stored in the fridge. So we do it, then we tell you, out of your 8 embryos, maybe 3 are very okay, they're euploid, they don't have any disease. So if we are doing everything to make sure that our success is higher, it means your chance of even getting pregnant will be higher. Yeah. And if there are certain families that have, example, breast cancer history, maybe the grandmother had, the aunt had, the mom had. So with using technology like that one of pre-implantation genetic testing, we are able to find out which of these embryos are not having breast cancer. And then those ones are the ones we will implant them back to you. And we make sure we follow you up throughout your whole pregnancy, or if you prefer to go to your doctor. So sometimes it's just the knowledge. When the patient comes and you explain, you know, every couple is different. Some have this issue, some have that issue, and maybe they've stayed for long, like you said, 5 years, 6 years. And outside, people talk. They say, oh, if you have this, use this herbal, use this, use that, and it's not been working. So sometimes it's the information. Once you tell the patient, you put her on the right track. You tell her, okay, I have seen your problem. Maybe you have some polyps, you have some fibroids, and if you want, these ones can be removed laparoscopically. These days we don't open the tummies, and like before we use camera. So once all this is sorted and you try to conceive, it might happen. So it's the education part. Then also there's the counseling part, because most of the times the couples we see, they're in the brink of their marriage. Something hasn't been going right. They haven't been having, yes, we know mothers-in-laws and everyone has been up to you. You've not been having a baby. So these are people who are really stressed. So sometimes we end up consulting couples for 1 hour, 2 hours, because they want to tell us how much it has been a problem to them. So we do try to give you hope, because if you didn't try any procedure, then it's good for you to try first and say, okay, I have done my best. I was told that I can do IVF and I did it. Maybe it was successful, maybe for some it was not successful, but they know, yes, I did up to the level that I did my best, and Allah is the all-knower. You have a reason. Once you've been diagnosed, you've been told your problem is the, let's say, tube, because that's the most that comes around here. Your tube is blocked. Now, because maybe you don't have the money to come to such a center, or because you don't have the knowledge, you prefer maybe to do what your friend did, or someone in your family, they told you, oh, I use this medication. Yes, herbal sometimes it does help. It helps to those people who want, but it's always good for you at least to know, you know, the name of that medication in English. If the name is there, then you can also do Google and see and search and know, like, oh, this medication is like this, what it does is this. But also don't waste your time too much. We know the eggs of a woman after the age of 35, there's a decline in the quality. So you don't want to be wasting your time. First, you've been married, let's say for 5 years, you're not getting pregnant. Why would you want to waste your time 5 years using herbal? Yes, we are not against herbal, yes, but we're just saying as your egg quality declines, you should also seek medical attention. The herbal could help, yes, but also the drugs that we are saying here that we are using hormonal injections. Those are that provide you with extra FSH and all these hormones that make your egg grow bigger. And if you are lacking in any vitamin, then we have a lot of multivitamins. So depending on where you lack is where we will now be supplementing you with. There's no particular drug that is for all. Everyone has an issue of their own. But there are many in the market that you can get, and if they are prescribed by a fertility specialist, then they'll surely help you.
What is your advice today to those people who are either infertile or they have never had anything to do with infertility? When you are married in a family, everyone wants a child. We get married because of family, creating family and union. But now you are home, you are not sure if you are infertile, that is one. And there is those people who are feeling like they may be infertile. What is your general advice to them?
Use of substances. We know it's proven, right? Mira, mogoka, smoking, alcohol. Too much of it does cause a problem in the production of sperms, in the egg quality. Extra substances that people use. So if you are using hizi dawa za kuongeza nguvu, right? Hiyo kazi yake ni kuongeza nguvu. Sisi hapa tunahitaji ile sperm, ile mani ikue ndio iko quality nzuri. But if you are addicted to doing all these other things, which is haram, by the way, so it means your concentration between you and your wife when you're having intercourse is not the way it's supposed to be. So first, already that could be a cause of why you are being infertile, because you cannot produce when you are needed to produce. And then another thing, we have all these microplastics, which we say they are endocrine toxic. We know at home we use a lot of plastic containers. In the water, we are storing them in plastic bottles. Now imagine you've had your own child, let's say from nursery until university. She's just using plastics. Kila siku anabeba chakula moto tena. Hiyo plastic anakuwa anakula in micro doses, which is harmful. Yes, and it is endocrine toxic. Inaharibu hizi organs ambazo zina produce hormones, na hormones ndio kitu muhimu katika reproduction. So vitu kama Viagra, yes, sometimes it is medically allowed to use because we need to reproduce the sperms, but if you are an addict, hiyo sio tabia mzuri, sababu itaharibu ile function yako ambayo inahitajika ndo upate mtoto, right? So jaribu kabisa, maybe seek a psychologist advice, because hao ndo wana deal na mambo ya addiction. For advice, as a take home message, stay healthy, have a healthy lifestyle, and when you have seen, you have tried for more than 6 months and you are not conceiving, then seek medical attention. Ask a fertility specialist. If you go to any gynae, they have a basic knowledge of fertility. Yeah? And once they see it is advanced, that they cannot handle it, then they send you to a fertility specialist where you can be helped. Usikae piki yako, ukanyamaza, mimi sizai, mimi tasa, mimi niko na hivi. No, these days we have we have hope, we have some sort of treatment that we can help you with.
Foods, what are the foods that we can eat to boost our fertility rate? I said I'll have so very many questions once we come back.
So food, there is no particular food. Food, you have to have a balanced diet. It's not one day unajijazia chipsi na mabaga, siku ingine unakula hivi. Kwa watu wetu kama especially nasema wa Mombasa, tunapenda kutumia manazi mingi, mafuta mingi, vitu vya sukari, na mwanzo siku hizi tuk kila pahali, hata kutembea tutembei. So go back, ukiona uko na hiyo shida, we mwenyewe wajijua. So go back, try to have a healthy lifestyle, meaning utembee zaidi ama ujoin gym, and then in other words have a balanced meal. Balanced meal namaanisha fruits mingi, mboga nyingi, yes, carbohydrate kidogo na nyama ya kutosha. Kama unaona uko na kilo zaidi, juu tunapima BMI, unaona uko na kilo zaidi, jaribu, na hatusemi upoteze kilo 20 kwa mwezi, no. Try to be moderate, 1-2 kg per month. In 5 months that's 10 kg. So unajaribu wewe mwenyewe, unajua shida yako iko wapi. Kwa hivyo jaribu kujihisi, uone okay, naweza kufanya hivi, naweza kufanya hivi kwa uwezo yako. Si lazima utumie mapesa mingi. Jaribu tu wewe mwenyewe kujirekebisha. Niko na addiction ya hii na hii, na sasa nimeoa bibi yangu. If you think, so first of all, even if you don't have an idea about fertility, you have an idea about your monthly period. If you are not getting it, that is a problem. If you are getting it once in a while, it's a problem. If you are getting too much of period, it's a problem. If in terms of man you don't have the power to have an erection or to produce any semen, then that's also a problem. Already you have some sort of diagnosis. And then you can go now to the doctor and get the professional help. Here, me being a Muslim woman, I practice Sharia compliance. So it's only this artificial reproductive technology that is done using the husband's sperm and the woman's egg. We do not do any donations here, and we do not do any surrogacy because at the moment it is not allowed in Islam. So when you come here, just know that we will treat you as a couple. And to all the men who feel shy and everything, you tell your wife, oh, you go and check me, I'm okay. It's very important. Yes, as you support your wife, you also get checked yourself so that we know. Yeah, unless you tell us that you have a 6-month-old child or a 2-month-old child that you have fathered, for us it is infertility. So we need to know your sperms, we need to know the egg quality, we need to do your hormonal levels, we need to know that everything is okay, there's no immunological issue. We advise you even within these months that you are seeking fertility treatment, maybe do this, maybe try this, maybe, you know, as first we want you to conceive in your own natural way. Then when it's not possible is when now we come to artificial technology.
Mashallah, Daktari, thank you so much for making your time for us. It was such a very interactive session, and I believe our viewers back at home have learned about infertility, what they should do and what they should not do in order to become fertile. Inshallah, we look forward to be having you in our next episodes, and I believe you will help us know about so very many things that you people do here at Victoria Centre. To you back at home, ladies and gentlemen, it's been well said that you know yourself. Unajijua wewe mwenyewe. Make sure you seek medical attention whenever you feel like something is not working very well. Eat well, sleep well, and do your daily activities in a way that you feel you are okay. Until next time, my name is Kassim Mustafa. Masalam.